Hi, Dr. Greg Uchacz here with Proactive Health Group in downtown Calgary. Let's talk about ice versus heat. When should you use ice? When should you use heat? Let's talk about ice. Ice is really getting beat up in the literature these days. It used to be we want to ice all new injuries, and that's great. But the fact is that there are some negative effects to icing a new injury too. Like, I know we're decreasing the inflammation. I know we're slowing the metabolic rate of the cells. I know that we're causing an analgesic effect, making it feel better. But we're also delaying healing. We're also tightening up muscle tissue. So there's some stuff in here that might not be fantastic to ice. So here's a general rule of thumb. If you're going to ice a new injury, ice it for a maximum of 2 days, the first 48 hours, and 10 minutes on, 10 minutes off. And that 10 minutes off is meant to just bring it back to room temperature and then put ice on it again. But do not ice for more than 2 days. The reason being you would ice is that there is an inflammatory response called an acute inflammatory response. Not only is there increased blood flow going to the area to bring in healing stuff, but the blood vessels open up so all that healing stuff can go into the area. But after 2 days, that permeability of the blood vessels tighten up again. So even if there's swelling, the blood vessels aren't putting more stuff in there. So after 2 days, get heat in there. Get increased blood flow. Get it flowing. Get it moving. So max 2 days for ice. After that, any chronic thing, anything after 2 days after hurting is always heat.